welcome to another exciting episode of the Heart Next Door podcast. So excited to share space with you all. If you are listening, as we always say, if you're here, you're home. Welcome in for another phenomenal conversation with an incredible leader in the maternal health space. Today, I'm so excited to welcome Dr. Lahnor Powell. Welcome.
Thank you.
So excited to have you. For those of you who do not know, Dr. Lahnor Powell is a naturopathic doctor and a doula whose expertise fuses integrative medicine with compassionate birthing support. With her naturopathic medical degree from Southwest College of Naturopathic Medicine, she specializes in women's health, clinical nutrition, and a master's in public health focused on community health education from the University of Alabama. As an international educator in functional medicine, Dr. Powell equips medical professionals with cutting-edge health knowledge. Through her company, Okana Care, she uses her journey as a mother of 3 to empower new parents with holistic parenting education. Her approach encompasses herbal remedies, nutrition, and lifestyle strategies, offering a nurturing experience to enhance prenatal wellness and ensure a supportive postpartum journey. Dr. Powell is dedicated to enriching the path to parenthood with informed, health-focused guidance. Welcome again. We're so thankful to have you. How are you?
Yeah.
Wow, what an incredible journey you've had as a professional, also as a mom of 3. So I'm so excited to dive in and just to give you an opportunity to share all of your knowledge and wisdom with our community. And before we dive in, I'd really love to start with you. What first called you into the maternal health and birth work space?
Well, ever since being a child, I've always loved little kids, thought they were super cute, but it wasn't until I actually had my own first daughter. And that's when I kind of was a little bit too confident in the postpartum period, where I was thinking, because I have all this education, I have all this knowledge, this should be a breeze for me. But when I entered into that postpartum space myself, that wasn't really the case. I felt myself very confused. I had more questions than I had answers. I found it hard to, even with my research background, take the literature that was available, which is very small, and really make heads or tails of it. I was just frustrated with the whole entire process and how there was a lack in maternal care in that postpartum space. So after my first baby, then I decided to just find any piece of information, literature, resource, ask the grandmas, ask the aunties of the world, and just try to really understand what was happening to my body, and really try to understand in the future, because I did want more kids, like, how do I kind of improve my body? What do I need to do to improve my postpartum period? Because in general, my pregnancy was just a breeze. Now, as I got older and had 2 more kids, my pregnancy wasn't necessarily as much as a breeze as it was the first time, with morning sickness coming in at random times of the day. So I also was able to utilize the information I've been researching and digging through to help alleviate some of those symptoms I was experiencing in the pregnancy. And then, even though I had 2 semi-emergent C-sections for my first 2 babies, the information that I accumulated and how I applied it, I was able to successfully have a VBAC-2, which means an all-natural vaginal delivery with my 3rd child. And there's a difference in how you recover. There's a way that you can intentionally approach postpartum, or there's another way that you can just let it happen to you. But I'm a person who likes to focus on preparation versus reaction.
Wow, that's beautiful. And I love what you pinpointed, which is something that I hear often when talking to leaders, is that there are 2 different sides of the experience. When you are a practitioner or a leader serving moms, right, you have a very different informed experience, but then when you're on the other side, you realize firsthand how many gaps there still are, even with all of your knowledge. So how phenomenal that you were able to really step up and meet that need. And I know you're both a naturopathic doctor and a doula. So talk to us about holding both of those roles and how that shaped the way that you care for mothers differently.
The doula is a position where you are not actually a practitioner. This is a position where you are a support system for the mother. You're holding space for her emotions. You're holding space for her pains that she's experiencing. You're holding space for the questions and different things she is trying to navigate as she as she grows her family. And you're even holding space for the birthing support partner to show them how to enter into this sacred moment and be a support system and not shy away, not hide in a corner, but be present in this moment as well. Whereas the naturopathic degree teaches you more about the anatomy, the biochemistry, the physiology of what's actually happening. Now, the way I married those two together, even though I had my naturopathic degree before I got some, more advanced doula training, is I have a greater degree of compassion. I have a greater understanding of the emotional aspect that comes about through this pregnancy and this postpartum time period. So that's why I thought it was important to get both of those pieces of information. And with my naturopathic degree, we pull in from a lot of Eastern, but also Western modalities. So we pull in acupressure, acupuncture. I can pull in nutrition, herbal therapies that are safe to use. It's some that are safe to use in pregnancy. I can pull in movement. I can pull in homeopathy to really help that space that women are kind of creating for themselves in this motherhood area. So that's kind of how I married the two together. And that's why I thought it was important for me to understand that with, the doula training, the movement of the hips and what that does for that sacral, iliac, pelvic flora kind of environment, understanding the different breaths you can take and seeing how that can help change how your body is responding to pain, how your body is responding to the stress. So it allows me to have just more tools in my toolbox to address women during this period.
For sure. And how beautiful is that you take such a multidisciplinary approach to it. And I think that that is something that I could definitely see being beneficial. I know you and I had a conversation earlier where just highlighting the fact that from the very dawn of civilization, women have been giving birth, and continue to give birth all around the world. And so I think it's incredible that you're able to take and marry those various perspectives from different regions and also different areas. That's truly beautiful. And so in all of your work, what are some of the biggest gaps that you're seeing in maternal care, especially emotionally and educationally?
There's quite a few gaps. I'm seeing just the lack of believing women. So what we're seeing in terms of the postpartum complications and the maternal deaths and all these things, what we're seeing are signs that showed up long before the problem actually got severe or critical. And we're not educated to understand these signs, nor are practitioners educated to react when the beginning of the signs start. They are more reactive, not proactive. So for example, if you have a client that comes in with swelling, unusual headaches for them, whether it's in frequency or intensity, or whether it's why those headaches are triggered. If you have a female that comes in with swelling or discomfort in the abdominal region or puffiness in the hands or visual changes, then those are all signs of what's called preeclampsia, which is high blood pressure that can occur in pregnancy. It can start during delivery, but it also can start postpartum. And so women are not tracking their blood pressure appropriately. So I tell every woman who is pregnant, you need to get a blood pressure cuff. You can get one that's cleared through your insurance company, and it might cost you $0. You track your blood pressure. And if that top number or that bottom number, if you start to see significant changes, then you need to notify your practitioner. You need to keep a log so you can see the trends. And you have to continue 3 months postpartum, because I'm seeing it quite a bit where I'm having to tell women, go back to the hospital now, because you're in danger of risks that occur with higher blood pressure, whether it's a stroke or something like that. We're also seeing that any other surgery that happens, blood loss is measured through weighing the gauze, weighing all the different things after that, during that surgery and after that surgery, to make sure the patient hasn't lost too much blood, right? We don't do that with delivery. And when we're having more C-sections, which is one of the surgeries that actually cuts through the most layers in the body, a C-section is, we're not tracking the blood as we would another surgery. And the problem with hemorrhaging is that it doesn't necessarily come out of the body. And what I mean by that is, if you cut your finger, you can see a lot of blood loss. Oh no, right? But when you have a C-section, the blood loss can get contained within the abdominal region. And you might have a tender belly. Maybe some of that blood will come out in your catheter that's attached to your bladder to help you, make sure that it doesn't accumulate in your body. But if we're not monitoring, if we're not tracking women, if women don't understand those symptoms that we need to look for, like the heavy bleeding that won't stop, blood clots the size of a golf ball that might not, that may still be continuing way after postpartum, like into week 2 or 3. If we're not paying attention to those things, if we're not measuring women's blood markers, looking at their iron, then we're missing about 80% of preventable complications and deaths that women are experiencing in postpartum.
Of course, this that 80% number of like preventable maternal deaths is a number that's pretty familiar to me. Actually, it's one of the reasons, like one of my driving forces, I feel like, that led me to dive deeper into the maternal health space and just understand like what's at the heart of it, because that is such a gigantic number.
It is.
And the way that you illustrate, like even just the cases in which you have to tell women go back to the hospital, like the truth in that there's so many things that we don't know or aren't prepared to handle or look for in terms of like the signs and the symptoms. So, wow, thank you for highlighting that and really, showcasing where the need still lies. And so for women who feel unheard by providers or unsure how to advocate for themselves, what encouragement or practical advice do you offer them?
Okay, so you can't give up. You are the person that has lived with your body the longest. You know your body the best. And so if you're measuring your blood pressure and it's going up and up and up, and every time you go in for your appointment, you're looking at your lab work and seeing a letter H next to protein urine, you need to really advocate for yourself. Show the doctor the trends, show the doctor the patterns, and hopefully you are interviewing your OBGYN doctor ahead of time, and hopefully you know what type of hospital you will be delivering in, because you have what's called baby approved hospitals, which promote breastfeeding, and then you have your other types of hospitals. So you want to make sure you understand that. But when you are in a hospital setting, most of the time you are seeing a practitioner who is not your home-based practitioner in the, that you go see every week in the office. You have the ability to, number one, ask for the charge nurse if the nursing staff you don't feel are believing or hearing you. You have the ability to fire nurses or to basically ask or request for a new nurse to manage your case. You also in the hospital can pick up the phone and call your practitioner and get your practitioner to call the hospital and start really advocating on your behalf. If you don't feel heard, if you don't feel listened, you can either change the practice you're in, you can either have your hospital system call your main doctor. And when you get home, if you notice things are not right, something is off, you call in the doctor's office. I'd rather you call them and annoy them and be wrong than not to call them and be right about something is not happening well in your body. If you got discharged and you have to go back to the hospital system, always notify your primary doctor first so that they can tell the hospital system what's going on. And you have to use the right words. And unfortunately, that's just the way as doctors, we're trained based on keywords. So if you have to go back to the hospital after you delivered, keywords you say are, I just had a baby, they are this old, I had whatever type of complications, in pregnancy or before pregnancy, and after pregnancy, these are the symptoms I'm dealing with right now. You got to say these words, and it's almost like you have to have, information or knowledge. You have to be savvy on those key terms. But you can't just go in and say something doesn't feel right. You have to be very specific. And a lot of times as women, we're told you're over dramatic. We're told it's just natural. You just had a baby. But no, if you know something's not right, you need to say it, and don't be afraid. Stand 10 toes down with what you feel.
Awesome. Okay. So that's, thank you so much for, breaking that down and really sharing that with us. And now I'm really excited to learn more about this beautiful product that you've created from your work called My Pregnancy Journal. First, tell us, what inspired you to create it?
Yeah. So everything that we talked about was what inspired me to create it. When I realized that other practitioners in my field were coming to me as the expert, when I realized that my own OBGYN and, midwives and other doulas and things that I was, using to help support me in my pregnancies were asking, how did you recover so fast? Why is there no scar tissue after your C-section? How do you have so much energy? When they started asking me questions, that's when I realized, I think I stumbled upon something. I think I understand something. I think I was able to pull together the information. And when I applied it to my third pregnancy, and when other people have applied it to their pregnancies, I'm also seeing these really wonderful results. And what I realized is when we go take the wisdom from our forefathers and foremamas and four Grammys and four pappies, right? When we take their wisdom, there's there's actually a few big commonalities, regardless of if you're from Asia or if you're from Africa or if you're from South America, regardless of where you're from, we start to see some common denominators. One is going to be community. So you have to foster a community of healthcare providers, of multiple disciplinary providers. So like massage therapists and acupuncturists and chiropractors, pelvic floor specialists, lactation consultants. But you also want to have a community that can support you, whether it's with meal trains in terms of your girlfriends to come over, clean your house or clean your car or something like that, to just give you that moment of just quiet solitude. Okay, something got done even though I didn't do it. There also is this aspect of diet and nutrition where warming foods are utilized in herbal therapies and baths and calming, soothing, restorative things that also provide a lot of nutrients to the body to help heal you after the delivery of the baby. Because keep in mind, we're losing about 2 cups of blood for an average vaginal delivery and up to 4 cups if you are doing a C-section. Wow. So there is this sense of, I need to recover. I need to rebalance my hormones and everything else that's happening. And then also your environment is very important. In other cultures, you either go to a location or the location comes to you to help you with the recovery, whether it's Grammy, Pappy, usually it's a female in the community that comes to your location to really help you recover. So I wanted to take these main principles, I wanted to put it into a journal that is like a keepsake that you can pull out when your kid starts to get pregnant and have kids or grow their family, and you can share it with them. But I wanted to have a space where we can focus on mental health, where we can focus on diet, nutrition, lifestyle, where we can focus on building your community and have it all in one centralized location. So I created, I created a pregnancy journal. Give me 1 second. Is it blurry?
It was at first, but I think if you take I think when you held it up the last time, I could see it.
Okay, let me see. No, I still think it's blurry here. Let me take off one of the video settings.
Okay.
That'll help, okay? Yeah. Okay, so I created a journal. As mentioned, it's called My Pregnancy Journal. Mm-hmm. And in this journal, I really step you through the different areas of pregnancy. There's always going to be a daily planner, because as women, we need to make sure, as you know, we're managing families, we're managing occupations, we need to really make sure we're able to keep things organized. I also highlight the importance of how do you pick the right multivitamin in pregnancy or prenatal vitamin. What should my diet look like? There's spaces where you can really just let out the emotional floodgates that are happening in your head. And this journal allows you the space to let out the positive emotions, but also to say, you know, today really just was not what I expected. My morning sickness sucked. You know what I mean? It allows you to kind of let out all of these emotions. And then there's a lot of checklists in here to help you prepare the nursery, to help you prepare a baby bag, to help you prepare whether you're going to a hospital delivery, a birthing center delivery place, or if you're going to deliver at home. There's checklists to help you. Even when it's time for you to say, okay, job, these are my last few days. Like, what information do I need? Like, even if you're your own entrepreneur, business owner, how do I transition my company from me being out for a certain amount of days or weeks, you know? And then there's a big section up to 12 weeks covering the postpartum period, because we need to understand, like, okay, this is a little bit different than pregnancy. My nutrient demand is different. So how do I change my diet for this period? Even as simple as, how do I pick a daycare? How do I pick a pediatric office? When should I start looking at those things? These are things that happen way early in pregnancy that, honestly, with some nurseries in my area where I live, they have a waiting list of 18 months. Now, do the calculation in your brain. You're only pregnant for 9, right? So people are getting on these waiting lists like even before they're conceived, and even before baby is like in the belly, in the womb, you know? So the journal walks you through all these different spaces and times of pregnancy, and it even talks about what do I expect during phase 1 and phase 2 of active delivery or early delivery, or during the transition period. So it walks you through everything. So it's almost like having a doula in your pocket, is what I like to tell people. It basically provides you all the information that I would give you as a doula naturopathic doctor. And it's something that you can have as a resource. And it's small enough that it can fit in your diaper bag. It can fit in your purse. It has pockets and different things for you to store information. It has tabs, checklists, everything you need. I put it into one beautiful resource.
Wow. You literally, like, as you went down the list, you thought of everything. It's beautiful. And I know it's going to be a really big difference maker. Can you tell us, how have you seen, specifically when you had the idea for this, right? What made you choose to put it in a journal specifically? And how have you seen tools like journaling or symptom tracking change the relationship that women have with their care and providers?
Because it's proof, right? When you're journaling something, you're tracking something, you notice patterns faster than when you try to store things in your head. And so it allows you to bring this to the appointments and say, hey, doc, look, my blood pressure this appointment, now this appointment, or hey, doc, at first I had a little bit of swelling this appointment, but I'm still having swelling these future appointments. So it allows you and the doc to look at how long have you been experiencing these symptoms, and it helps them to understand how fast do I need to react, or is this a concern, or is this not a concern, or, something like that. But basically, it just provides you the assurance, especially that, okay, I'm eating well, or it provides you the assurance that, okay, I'm ahead of schedule. I got my nursery prepared, or something like that, right? So it's really like a keepsake assurance provider, but it also teaches you how to advocate for yourself as well. So I've had this idea of supporting postpartum for a long time, but because, again, I'm really keen on prevention, I realized if you start preparing for postpartum after the baby is here, you're already behind the 8 ball. So you have to prepare in pregnancy. So I was like, okay, how do I integrate preparation for postpartum in pregnancy? And I had my own little way, wrote a transcript. It's about 5 years old. And then I sat on it because I wasn't sure if this is what people wanted, if this is what they needed, and then one day I was like, I just need to get this.
Yeah.
I need to figure out how to get it published.
Yeah.
I need to figure out a designer, some artwork. I just need to figure everything out, and people will understand, people will love it, and just have that assurance. Right? And for people that have brought the journal already, I have 2 ladies that have already brought the journal, had their babies, that I'm thinking of right now. And they just mentioned that it really helped to keep them organized, helped to allow them to progress through their pregnancy in a way that was just really beautiful. And so I know it helps people.
Yeah, for sure. I know it does too. I mean, I'm just thinking back to both of my pregnancies, and that would have been truly like a lifesaver to have a resource like that. And so I'm just so grateful to you for, I think it's one thing to have an idea. Even you mentioned, like you said on the transcript, for 5 years before you were like, no, this is something that the world needs. And I'm so happy that you did, because in turn it's going to bless, as it already has, and like help so many women and so many moms. So that is so beautiful. Congratulations on that. And yes, as we start to wind down, I have a couple more questions for you. The first is, as someone deeply immersed in this work, how do you protect your own well-being while you care for others?
I don't do great at it. I'm gonna be honest with you.
I love the honesty.
It's really hard. I'm a mother, as you mentioned, of 3.
Yeah.
I have a 4-year-old, a 6-year-old, and a 9-year-old. We just finished up our soccer season, so you can imagine how busy that is. Sleep. I don't get my 8 hours of sleep every night. I have about 1, sometimes 2, or sometimes all 3 kids waking up in the middle of the night. But what I realized was sleep, movement, and nutrition. Those are kind of like my 3 big pillars that I really try to focus on. And when I focus on those 3 big pillars, I do better. Right? And then adrenals, I incorporate just specific herbs that not only help my adrenals, but they also help my nervous system. So some days I'm a little bit more sensitive to sound and noise, even to my own name. I don't even want to hear that some days, right? Even light, sometimes I'm sensitive to it. And so I use specific herb called shatavari. Shatavari is an extract of asparagus. It's known not only in your Ayurvedic medicine arena, but also in your Chinese medicine arena. I think they use a different name for it. But being consistent with that helps my nervous system. And I also like doing puzzles, and I like crocheting. And so making sure that I'm intentional about doing those types of things also help my nervous system. So those are just a few things, making sure I'm taking my vitamins and my collagen and things like that. Because I did cross that 40 threshold about 2 years ago, and things changed, So really just being intentional, I think, is really the big thing. And the hardest thing is asking for help. I think that's the hardest hurdle. So learning how to ask for help when I need help. Or even like when I start to feel myself get a little bit off balance, getting the help before I am off balance, or taking that nap, or taking that rest, or that breather. I think that's probably the biggest thing for me.
Wow. Thank you so much for your vulnerability, because I think that as someone who has accomplished so much, and like who provides so much for women, so much support for moms, it is very humanizing, and also like affirming to hear that even you, have to, ask for help, have to learn how to stop and like take care of yourself. And it's really just highlights the fact that it's a common struggle that all women experience, and we all have to find our own ways to navigate them. So thank you so much for sharing how you integrate that into your daily life, because that is truly beautiful, and that's really what it's all about. And so We know that birth and motherhood are incredibly transformative, right? But they can also be very isolating too. And so, how do you think that we begin building a culture and a future where mothers feel more supported and less alone?
I think it starts with the community aspect that I was mentioning earlier. You have to build that proper community around you, your friend network, because most of us moms move away from what's called our nuclear family. So I don't live near any grandmas, any pappies, any aunties, any cousins, right? And it can be very isolating, like you're saying, because I'm not a person that, meets their best friend all the time and they come over and they hang out. Like, that's just, I like I'm kind of introverted, I guess you can say, right? And a lot of my friends I know are in other cities and other states. And so it is very isolating sometimes when you're trying to reach out to a friend, but you're like, oh no, they have 5 kids, or, oh, they already have their kid and their marital stuff going on, But it's building that community, intentional community with your healthcare providers and finding those few people that you can latch onto for just support and real support. I think that's going to be very key, and helping all women and even the birthing partner, the spouse, understand what we're going through during those periods of time. That'll also allow them to be more compassionate, and give us the help that we need in those moments. So that's what I would say. We just kind of have to go back to the idea of community, really.
Yeah, for sure. That's what it's all about. And I love that even, as reflected in the journal that you've created, my pregnancy journal, you mentioned just the idea of going back to what the traditions were of our ancestors and our forefathers. It reminds me of, the proverb Sankofa, where we go back to look forward and understand where we're going. And so I think that you have hit it on the head, like, so beautifully. We have to get back to caring and community together. And so thank you so much for the beautiful piece of artwork that you created to kind of provide another tool and another channel for us to be able to tap back into that beautiful power of community for better maternal health outcomes and family outcomes for us all. So just thank you so much for your work. And I'm super excited and very honored just to share with everyone in our community the promo code that you provided for everyone to get access to my pregnancy journal, which is absolutely amazing. Thank you so much. We're so excited about that. And I know you all will truly enjoy getting your hands on Lanor's incredible tools. So if you are interested, you can use the discount code HeartNextDoor15. It's all one word. Again, HeartNextDoor15. And we'll also put it in the description box as well with the link to a direct link to find the tool as well. Lahnor, is there anything else that you want to share that you're excited about? Please tell everyone how they can connect with you as well.
Yes. So I am excited that the conversations are happening. I am excited that there are several males getting involved with these conversations as well. I am excited that you have politicians who are starting to talk about this topic. So there is a greater level of understanding that, hey, we need to do something. And I think that's very exciting. But I also think that it'll be important for us to be mindful and to be aware as well. So can't just ignore what's going on. We have to advocate for our fellow females. We have to advocate for our future generation as well. So let's see, on Instagram, you can reach me at Dr. Lahnor Powell. And even just typing in, Dr. Lahnor Powell in TikTok, you can also reach me there as well. But my username on TikTok is Okana Care, Okana Care, CARE. So that's how you can reach me in the social media world. My website is okanacare.com, OKANACARE.com as well. You can also reach me there.
Awesome. Thank you so, so much. Well, again, Dr. Powell, it's been a tremendous honor. So grateful to be connected. And again, so grateful to you for sharing your work and your gift with the world, and especially with moms who need it the most. And yeah, thank you so much, everyone, for listening. We'll see you next time on Her Next Door. Bye.
Bye.